Imagine breaking your leg right now with no hospital, no ambulance, and no trained doctor anywhere nearby. For most of human history, this was not a frightening hypothetical. It was simply everyday reality. There were no medical degrees, no clinics, and no white coats anywhere on the entire planet. So why didn't ancient humans simply go to a doctor when they became sick or injured? The honest answer is that something we would recognize as care still existed, just not in the form we expect today. Archaeologists studying ancient bones have found healed fractures, healed skull surgeries, and evidence of long-term nursing care. This means many ancient humans survived injuries that modern people often assume would have been an automatic death sentence. By the end of this video, you will understand exactly who treated the sick in ancient societies and how. You will also learn about real ancient surgeries, real ancient medicines, and why some of them actually worked. This question matters today because paleopathologists, scientists who study disease and injury in ancient remains, keep uncovering surprising evidence. Their research shows that ancient healing was often more organized, more skilled, and more effective than most people assume. Anthropologists studying healing traditions worldwide argue that the instinct to organize structured, specialized care emerged surprisingly early in human history. Later in this video, I will explain who exactly played the role of a doctor in a world without hospitals. I will also explain how ancient people performed actual skull surgery and why many patients survived the procedure. You will discover which common ancient plant contains the same active ingredient found in a pain reliever many people take today. And you will learn why some ancient wound care habits are now being studied seriously by modern medical researchers. Understanding ancient medicine might completely change the way you imagine life before modern hospitals ever existed. For roughly 95% of human history, there was no written medicine, no formal training, and no licensed professionals of any kind. Yet skeletons recovered from this same enormous span of time regularly show clear evidence of healed injuries and long survival afterward. This means care, in some real and effective form, was happening constantly, even without anything resembling a modern hospital. The most common myth about ancient humans is that sickness or serious injury almost always meant a swift and certain death. In reality, paleopathological evidence tells a far more complicated and often surprisingly hopeful story about ancient survival rates. One of the most famous examples comes from a Neanderthal skeleton known as Shanidar I, discovered in a cave in Iraq. This individual had a withered arm, damaged eyesight, and evidence of a healed skull injury sustained many years before death. Despite these severe disabilities, this person clearly survived for years, which strongly suggests sustained help from other group members. There's something even stranger almost nobody talks about. This kind of long-term group care likely predates modern humans entirely. This challenges the old assumption that only fully modern humans were capable of complex compassion and organized long-term care. Instead of a single trained doctor, most ancient communities relied on several different specialized roles working together when someone fell ill. An herbalist, someone with deep knowledge of local plants, often handled wounds, infections, and general sickness using natural remedies. A midwife, someone specializing in pregnancy and childbirth, handled one of the most dangerous events in ancient daily life. A bone setter, sometimes the same person as the herbalist, specialized specifically in realigning and stabilizing broken bones after an injury. A shaman, or spiritual healer, often addressed illness believed to have a spiritual, rather than purely physical, underlying cause. This means ancient medical knowledge was distributed across an entire community, rather than concentrated inside one single formally trained expert. Imagine a hunter returning to camp with a badly broken leg after a fall during an unsuccessful chase the day before. The camp's most experienced healer immediately examines the leg, carefully feeling along the bone to judge exactly where the break occurred. Straight branches are quickly gathered and wrapped tightly around the leg using strips of hide, creating a simple but effective splint. The healer instructs the hunter to stay still for many weeks, while others in the group bring food and water daily. This kind of careful, patient, communal care appears repeatedly in the archaeological record across completely different ancient cultures and time periods. But here's what most people don't realize. Archaeologists can actually tell whether an ancient bone healed correctly or incorrectly after treatment. A cleanly healed fracture, with bones properly aligned, suggests skilled intervention rather than the injury simply healing on its own. Studies of ancient skeletons show surprisingly high rates of well-aligned healed fractures, especially in societies with strong communal support structures. This suggests ancient bone setters possessed genuine, tested anatomical knowledge passed down carefully through direct hands-on apprenticeship over many generations. Physical manipulation and massage also formed a meaningful part of many ancient healing traditions, used to treat muscle pain and stiffness. Healers applied firm pressure along specific areas of the body, often guided entirely by generations of accumulated hands-on experience. This practical, touch-based knowledge closely resembles techniques still taught today within modern physical therapy and sports medicine training programs. Ancient healers also used heated stones, warmed sand, or cold water immersion to manage pain and reduce swelling around an injury. This simple, intuitive use of temperature to influence pain closely mirrors treatments modern doctors still routinely recommend for common injuries today. Perhaps the most astonishing ancient medical practice of all is trepanation, the deliberate cutting or drilling of a hole into the skull. This procedure sounds terrifying today, yet evidence of trepanation has been found on every inhabited continent across many different ancient time periods. Archaeologists have identified trepanned skulls dating back at least 7,000 years, long before anything resembling modern medical knowledge existed. Remarkably, many of these skulls show smooth, rounded bone regrowth around the drilled edges, a clear sign the patient survived the surgery. Some researchers estimate survival rates for certain trepanation sites at well over 50%, based on this visible evidence of healing. In parts of ancient Peru, some skull sites show survival rates that researchers believe may have exceeded even those figures significantly. There is something even stranger almost nobody talks about. Some skulls show evidence of multiple successful trepanations performed on the same person. This means certain ancient patients survived this dangerous procedure not just once, but apparently several separate times across their lifetime. Nobody knows for certain why trepanation was performed, though researchers propose several reasonable explanations based on the surrounding archaeological context. Some trepanned skulls show fractures nearby, suggesting the surgery may have been performed to relieve dangerous pressure after a head injury. Other trepanned skulls show no obvious injury at all, suggesting a possible spiritual or ritual purpose behind the dramatic procedure. Imagine an ancient healer carefully scraping away at a patient's skull using a sharpened flint tool, working slowly and with visible caution. The patient, likely given herbs to dull the pain, remains still while the healer periodically stops to check the depth of the cut. Onlookers watch closely, some assisting by holding the patient steady, others perhaps chanting or performing a ritual meant to aid recovery. This combination of practical surgical skill and spiritual ritual appears again and again throughout ancient medical practices across many separate cultures. Obsidian, a naturally occurring volcanic glass, was carefully shaped into remarkably sharp blades used for precise ancient surgical cutting. Modern researchers have found that a freshly broken obsidian edge can actually be sharper than a modern surgical steel scalpel blade. Some modern surgeons have even experimented with obsidian blades directly, noting they can produce unusually clean, low-scarring surgical incisions. This suggests certain ancient surgical tools were not primitive at all, but genuinely well-suited to their specific and demanding purpose. Ancient Egypt left behind one of the earliest known medical documents, called the Edwin Smith Papyrus, dating back roughly 3,600 years. This remarkable document describes surgical cases in careful, methodical detail, listing symptoms, examination steps, and a specific recommended treatment for each. Some cases even included an honest note that a particular injury was simply beyond treatment, showing surprising clinical honesty. This suggests ancient Egyptian healers were already thinking in a structured, case-by-case medical framework, remarkably similar to modern clinical reasoning. Ancient Egyptian medicine also combined this practical surgical knowledge with prayers and spells, blending science and spirituality in a single unified system. This blend reflects a broader pattern seen across nearly every ancient medical tradition studied by modern historians and anthropologists. One of the oldest known medical texts, a small clay tablet from ancient Sumer, lists specific plant-based remedies for various common ailments. This tablet, dated to roughly 4,000 years ago, shows that structured medical record-keeping existed even before ancient Egyptian medical papyri. This suggests the drive to record and preserve effective treatments emerged independently in multiple early civilizations around the same general era. In ancient India, early Ayurvedic medical traditions organized detailed knowledge of herbs, diet, and body balance into a structured practical system. In ancient China, early physicians developed detailed theories connecting the body's internal balance to specific dietary and herbal treatments. Though these systems developed independently across vast distances, they shared a strikingly similar emphasis on careful observation and long-term patient tracking. This independent development across unconnected ancient civilizations suggests structured, systematic medical thinking emerged as a natural human response to suffering. Beyond dramatic surgery, everyday ancient medicine relied heavily on an enormous, carefully memorized body of practical plant-based knowledge. Willow bark, chewed or brewed into a bitter drink, was used by many ancient cultures to relieve pain and reduce fever. Modern chemistry later revealed that willow bark contains salicin, a compound closely related to the active ingredient found in modern aspirin. This means one of today's most common pain relievers has direct roots stretching back into genuine ancient medical practice and observation. Ötzi, a naturally mummified man who died roughly 5,300 years ago, offers remarkable direct evidence of this knowledge. Ötzi was discovered carrying birch polypore, a type of fungus with known antibacterial and antiparasitic properties, tucked carefully into his gear. Researchers studying his remains also found evidence of intestinal parasites, suggesting he may have been using this fungus as active treatment. This single frozen body offers a rare, incredibly direct window into the actual medical toolkit an ordinary ancient person carried daily. But here's what most people don't realize. Ötzi's skin also shows a series of simple tattooed lines near joints affected by arthritis. Some researchers believe these tattoos may represent an early, informal form of therapeutic treatment, similar in placement to modern acupuncture points. If true, this suggests ancient people were experimenting with targeted physical treatments for chronic pain thousands of years before formal medicine existed. Wound care itself relied on a surprising range of naturally effective materials, long before anyone understood the microscopic science behind infection. Honey, used across many ancient cultures from Egypt to parts of Europe, has genuine antibacterial properties confirmed repeatedly by modern research. Its thick texture and naturally low moisture content create an environment where many harmful bacteria simply struggle to survive or multiply. Spider webs, surprisingly, were also used in several ancient cultures to help wounds clot and to encourage faster, cleaner healing. Modern researchers have confirmed that spider silk does contain a specific protein that can genuinely help support natural blood clotting processes. There's something even stranger almost nobody talks about. Some ancient cultures used moldy bread or specific fungi directly against infected wounds. Long before penicillin was formally discovered in a modern laboratory, several ancient cultures had already noticed that certain molds fought infection. This suggests ancient healers were closely observing cause and effect in nature, even without any formal understanding of microorganisms or germs. Researchers studying ancient Nubian skeletons from a region in present-day Sudan found something remarkable preserved directly in the bone tissue itself. Chemical analysis revealed clear traces of tetracycline, a modern antibiotic, apparently absorbed through a fermented grain beer consumed regularly by the population. This suggests these ancient people were unknowingly consuming a genuine antibiotic substance, likely produced naturally during their specific fermentation process. This discovery pushed back the known use of antibiotic substances by many centuries earlier than researchers had previously assumed possible. Maggot therapy, the deliberate use of fly larvae to clean a wound, also appears repeatedly across several different ancient medical traditions. Maggots consume only dead tissue, leaving healthy tissue completely undisturbed, which modern doctors have since confirmed as a genuinely effective wound treatment. Some ancient battlefield accounts even note that wounds naturally infested with maggots sometimes healed noticeably better than clean, uninfested wounds nearby. This unusual observation eventually inspired formal medical maggot therapy, which some modern hospitals still use today for particularly stubborn infections. Evidence of successful ancient amputations has also been discovered, including a skeleton from France showing a forearm removed and fully healed. This particular amputation, dated to around 7,000 years ago, shows clean bone healing, suggesting the patient survived for years afterward. Childbirth represented one of the single most dangerous events in the entire life of an ancient woman, far more than most illnesses. Midwives, almost always women themselves, carried detailed practical knowledge passed down verbally from one experienced generation directly to the next. This knowledge included how to reposition a poorly positioned baby, how to manage prolonged labor, and how to handle serious bleeding. Certain plants were used specifically to help stimulate contractions, while entirely different plants were used to help calm and slow labor. Imagine an experienced midwife pressing gently on a laboring woman's abdomen, carefully feeling for the position and orientation of the unborn baby. She calmly instructs the woman to change positions slightly, drawing on years of accumulated experience passed down from her own teacher. Other women in the group stay close by, offering water, quiet encouragement, and physical support throughout the entire lengthy process. This kind of communal, experience-based care meant childbirth, while genuinely dangerous, was rarely faced by any single woman completely alone. Illness itself was frequently understood very differently in ancient societies compared with how modern medicine explains disease and infection today. Many cultures believed illness could result from an angered spirit, a broken taboo, or the intrusion of a harmful unseen force. This belief system meant that treatment often combined practical physical remedies with parallel spiritual rituals meant to address the deeper underlying cause. A shaman might administer a genuinely effective herbal remedy while simultaneously performing a chant or ritual meant to satisfy a spiritual explanation. Modern researchers studying the placebo effect have found that belief in ritual alone can meaningfully influence real physical healing outcomes. This means the spiritual half of ancient medicine may have offered genuine psychological benefit, working directly alongside physically effective herbal treatment. But here's what most people don't realize. Many ancient cultures also practiced a surprisingly modern-sounding form of basic disease containment. Some archaeological and anthropological evidence suggests sick individuals were sometimes isolated from the wider group during especially contagious outbreaks of illness. This instinct towards separating the sick closely resembles the basic underlying logic behind modern quarantine practices used during infectious disease outbreaks. This suggests some ancient communities intuitively grasped the idea of contagion long before anyone understood bacteria, viruses, or germ theory. Ancient communities also appear to have recognized and responded to mental distress, though they rarely described it in modern medical terms. Rituals, communal storytelling, and structured periods of rest were sometimes used to help individuals recover from grief or severe psychological shock. This suggests ancient care extended beyond the purely physical, addressing emotional well-being through community support rather than isolation. Archaeologists have now documented well over 1,000 trepanned skulls across sites in Europe, South America, Africa, and Asia combined. This sheer number strongly suggests trepanation was not a rare, isolated experiment, but an established and repeatedly practiced medical procedure. Despite these genuine areas of skill, it would be misleading to suggest ancient medicine matched the safety of modern healthcare. Life expectancy in most ancient societies remained significantly lower than today, driven heavily by high rates of infant and childhood mortality. Infections that are now treated easily with modern antibiotics could still spread rapidly and prove fatal, despite the best ancient care available. This means ancient medicine represented remarkable resourcefulness within genuine limits, not some hidden, fully equivalent alternative to modern medical science. Paleopathologists studying survivorship carefully note that the healed skeletons we find only represent people who survived long enough to heal. Many others undoubtedly died from injuries or infections before any healing process could ever begin, leaving a naturally skewed archaeological record. This means our evidence of ancient medical success is real, but it likely represents only part of the complete original picture. Even accounting for this survivorship bias, the sheer number of well-healed serious injuries still points toward consistently skilled ancient intervention. Researchers note that life expectancy figures can be misleading, since high infant mortality significantly lowers average numbers across an entire population. An ancient adult who survived childhood illnesses and childbirth complications often lived a genuinely long life, sometimes into their 60s or beyond. This nuance suggests ancient healthcare, while limited, was often more effective for survivors than blunt average life expectancy statistics initially suggest. There's something even stranger almost nobody talks about. Ancient healers often had to diagnose illness using only their own five senses. Without laboratory tests, healers relied heavily on smell, the color of skin or waist, body temperature, and the sound of breathing. Experienced healers reportedly became remarkably skilled at recognizing patterns, learning to associate specific symptoms with specific, predictable outcomes over time. This pattern recognition, built entirely through repeated direct observation, functioned as a kind of early, informal diagnostic system without any written textbooks. Knowledge of which plants healed and which plants harmed was considered extremely valuable and was rarely shared carelessly outside the community. Apprentices, often chosen from a young age, spent years memorizing plant identification, correct dosage, and proper preparation methods through direct practice. A single mistake in this process could easily mean the difference between an effective treatment and a genuinely dangerous poisoning. This high-stakes apprenticeship system meant ancient herbalists carried real expertise, refined carefully over an entire lifetime of hands-on practical experience. Different regions of the ancient world naturally developed entirely different specialized medical knowledge, based directly on locally available plants and animals. Arctic communities relied heavily on animal fat and specific organ meats to prevent nutrient deficiencies during long, sunless winter months. Desert communities developed detailed knowledge of specific succulent plants capable of treating burns, dehydration, and various common skin conditions. Forest-dwelling communities often had access to an especially wide range of medicinal fungi, bark, roots, and other complex plant compounds. This regional specialization meant ancient medicine was never one single unified system, but instead thousands of distinct local traditions developed independently. Trade between different ancient groups sometimes allowed valuable medicinal knowledge, along with specific plants themselves, to slowly spread across vast distances. Certain particularly effective remedies, such as willow bark for pain, appear independently across multiple unrelated ancient cultures on different continents. This kind of independent rediscovery strongly suggests these remedies were genuinely effective, rather than simply a coincidence or empty cultural superstition. Dental care, often overlooked entirely, also existed in a surprisingly recognizable form across several different ancient societies and time periods. Archaeologists have discovered ancient teeth showing evidence of careful drilling, apparently performed specifically to remove decayed material from a cavity. One well-known example from present-day Pakistan shows drilled teeth dating back roughly 9,000 years, long before any formal dentistry existed. This suggests ancient people experienced, recognized, and actively tried to treat the exact same painful dental problems people still face today. Basic oral hygiene also existed in recognizable form, with several ancient cultures using frayed twigs as simple, effective chew sticks. Certain trees produce natural antibacterial compounds within their bark, meaning these simple chew sticks may have offered genuine dental health benefits. Some of these specific chew stick traditions, using particular trees valued for their antibacterial properties, continue in certain communities even today. Ancient Egypt also produced some of the earliest known prosthetic devices, including a remarkably functional wooden and leather artificial toe. Researchers examining this ancient prosthetic found clear evidence of wear, suggesting the device was actually used for walking, not simply decorative. This discovery shows that ancient medical thinking extended beyond simply treating injury, reaching toward genuinely restoring lost physical function. Not every ancient medical practice proved genuinely effective, and some treatments likely caused real harm rather than any actual benefit. Bloodletting, the deliberate removal of blood believed to balance the body, appeared across many ancient and later medical traditions for centuries. Modern medicine has since shown that bloodletting, in most cases, offered no real benefit and sometimes actively weakened an already sick patient. This honest limitation reminds us that ancient medicine mixed genuine effective knowledge together with mistaken theories that later proved incorrect. Aspiring healers were often tested carefully before being trusted with serious cases, since a single failed treatment could cost someone's life. Some cultures required a lengthy period of supervised practice, treating only minor ailments before eventually being allowed to attempt more serious cases. This gradual, carefully supervised progression closely resembles the structured residency training modern doctors still complete before practicing independently today. Skilled healers often held a position of significant respect and status within their community, recognized clearly for their valuable expertise. In some cultures, healers received special privileges, such as being excused from certain physical labor in exchange for their specialized service. This suggests ancient communities understood the immense practical value of protecting and supporting their most knowledgeable healing specialists. Losing an experienced healer meant losing decades of accumulated practical knowledge that could not easily be replaced by anyone else. This likely explains why healing knowledge was so carefully and deliberately passed down through structured apprenticeship rather than left to chance. So, what can modern people actually take away from understanding how ancient humans handled sickness and injury without hospitals or doctors? Ancient communities never had formal doctors in the modern sense, yet they clearly developed skilled, specialized healing roles within every group. Herbalists, midwives, bone setters, and shamans together formed a genuinely functional healthcare system, built entirely from direct observation and lived experience. Real surgery, including skull surgery, was performed successfully often enough that many patients clearly survived and lived for years afterward. Plant-based remedies like willow bark and antibacterial substances like honey were genuinely effective, later validated by modern scientific research. Spiritual and psychological elements of ancient healing likely provided real additional benefit, working directly alongside physically effective practical treatment. At the same time, ancient medicine faced real and serious limits, and overall life expectancy remained meaningfully lower than in the modern world. Understanding this balance helps us appreciate ancient humans not as helpless victims of disease, but as resourceful, careful, and often remarkably skilled healers. Somewhere between a shaman's quiet chant and a modern hospital's bright operating room lies an unbroken thread of human care. That thread stretches back further than most people ever imagine, long before the very first hospital or medical degree ever existed. This means the instinct to care for the sick and injured appears to be a deeply rooted part of human nature itself. Even the very earliest human communities, facing enormous daily danger, still consistently chose to protect and support their most vulnerable members. Modern hospitals, with their advanced equipment and specialized departments, can feel worlds apart from a healer crouched beside a small fire. Yet the underlying goal, easing suffering and restoring health through careful observation, remains remarkably unchanged across this entire span of time. Perhaps understanding this resourceful history can help us appreciate modern medicine not as something entirely separate, but as its direct continuation. If this glimpse into ancient medicine fascinated you, consider subscribing for more deep dives into forgotten human history and ancient knowledge. A quick like genuinely helps this channel continue researching and sharing these overlooked stories about how our ancestors actually survived. Share this video with anyone who assumes ancient life meant helpless suffering, since the real story is far more resourceful than that. In an upcoming video, we will explore how ancient humans actually treated deadly infections long before anyone understood germs or bacteria.